On this Wednesday night, grounded. The pandemic forces WestJet to slash jobs and flights.
People have sort of been panicked, they're frightened to do almost anything.
What's waiting in the wings for an infected industry? The complications with contact tracing and the labor shortage in labs. Why the solution falls short. Plus, the U.S. president's plummeting popularity in a battleground state.
Crucial for Trump.
We're in North Carolina where valuable votes are up for grabs. And tempers flare.
It's illegal! You're infringing on my rights!
The escalating fury over lobster fishing in Nova Scotia.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. COVID-19 is creating more turbulence for Canada's air travel industry. WestJet, one of the biggest airlines in this country, says fewer people are traveling, so it's unviable to continue operating flights to much of Atlantic Canada and a major city in Quebec. As of November 2nd, WestJet will indefinitely suspend all flights to the 3 major airports in New Brunswick, as well as Charlottetown, PEI, and Sydney, Nova Scotia. Flights to Quebec City will also be suspended, and the airline will significantly reduce service to St. John's and Halifax. All told, more than 100 flights will be eliminated. This drastically limits the options for people who need to travel to those destinations. And as Eric Sorensen explains, this is another sign of trouble in the skies.
A pandemic that has hurt the economy is just crushing the airline industry. WestJet cutbacks will further isolate the Atlantic provinces from each other and from the rest of the country. Cliff Saulnier has family down east.
It's a little bit disappointing, a little bit harder to connect with our children and other loved ones.
It's not shocking news. Hardly anyone is flying these days. Since March, WestJet would normally have carried more than 15 million passengers over 7.5 months. Instead, they've transported just 1 million during the pandemic.
Sadly, we can no longer maintain our full Canadian network of service.
I'll ask you a few health-related questions.
WestJet says it has put millions into making travel safe, but it doesn't help if no one's traveling, and a company that expanded for decades is suddenly shrinking.
Over the last 8 months, we are beginning to see these efforts unravel.
Some blame, in part, the 14-day quarantine required of travelers.
The restrictions for travelers trying to get in and out of Atlantic Canada is just asphyxiating the industry.
WestJet is not alone struggling to stay airborne. Regional carrier Porter Airlines, already shut down, has delayed restarting now till December. Air Canada scored a bargain takeover of Air Transat this week. The original price, $18 a share, slashed to $5. But Air Canada's second quarter saw 96% fewer passengers than a year ago. Third quarter results are coming soon and could be dismal as well.
What took our country's top carriers not years, but decades to build, and it's all going to unravel within a matter of months. It's going to be a massive impact to jobs.
Airline unions have called on Ottawa to inject billions of dollars to keep the airlines afloat.
Obviously, there's plenty of other industries which also are crying out for help.
This analyst says the airline industry may never fully recover in this country.
Business travel in particular is going to be sharply hit because employers are going to cut back on having their employees fly for work.
For now, WestJet is not offering refunds on the cancelled flights. It's giving credits for a service it hopes will return to normal someday. Eric Sorensen, Global News, Toronto.
Getting the airline business back on track will require a big change in the trajectory of this pandemic. Right now, in many provinces, case counts are climbing. Manitoba set a new daily record today, 146 new cases. Next door in Saskatchewan, there are 25 cases. Further west, Alberta has 243 more cases, BC 158. Out east, New Brunswick has 8 new cases, Quebec 844, and Ontario 721. And in Ontario, more cases have been linked to a major outbreak at an indoor cycling studio in Hamilton. A total of 69 people have now tested positive. 46 are patrons and staff from the Spinco studio in downtown Hamilton. The other 23 cases are secondary infections, people who were infected by Spinco members. This is considered one of the largest outbreaks at a fitness center in Canada. What's particularly concerning is the studio was found to be following provincial guidelines designed to limit the risk of COVID-19. Ontario public health officials say rules for fitness studios are now under review.
Even though they followed guidelines, there was obviously significant transmission, so I think we do need to review the guidelines, and that's in process.
Key to containing the spread of COVID-19 is contact tracing, finding everyone who may have been exposed. Those efforts are the responsibility of the provinces and territories, but the federal government has offered its support. Now the Prime Minister is asking why regions haven't taken full advantage of his government's offer. Mike Couteur reports.
I'm going to bring you into a room now. Okay?
As public health agencies across the country try to get ahead of the second wave of COVID-19, Prime Minister Justin Trudeau says his government is doing all it can to help. In an interview with CJOB Radio in Winnipeg, he says that federal money and manpower is available, but in some cases, he's waiting for provinces to pick up the phone.
We gave them $19 billion over the summer so that they could ramp up their testing. Unfortunately, not every province has hit the agreed to targets. In terms of contact tracing, we've made available federal employees that only are waiting for an ask from the provincial governments to come in and actually do more contact tracing.
Must not be talking about Ontario because we're kicking everyone's butt on testing.
Ontario Premier Doug Ford proudly pushed back on the Prime Minister's comments, but clearly contact tracing was an issue because Ford also announced the hiring of 600 more people.
We've hired 100 new contact tracers this week alone. We'll have almost 4,000 boots on the ground supporting our contact tracing efforts this fall.
Still, Ford's announcement and the Prime Minister's comments highlight the jurisdictional gap in this pandemic.
Well, it does sound like a frustrated Prime Minister.
This former federal health minister says Trudeau is dealing with the fallout of refusing to use the Emergency Act to take control of the response.
So you now depend on the goodwill of the premiers and the ministers of health to get the stuff done.
Leaving the response as a regional responsibility has allowed provinces to implement targeted public health measures. But COVID-19 fatigue is becoming a serious problem in certain regions. In Alberta, some aren't cooperating with contact tracers.
If we are not able to trace contacts and prevent the virus from spreading, the impacts will continue to grow.
Let's hope that warning will get through to people so that more drastic measures, like another forced lockdown, aren't necessary. Mike Couteur, Global News, Ottawa.
Ontario is doing a lot of testing, but the province is struggling to process them. Right now, there's a backlog of more than 26,000 tests. Global News has learned the province is launching a rapid training program which could put up to 600 workers into medical labs. That should help ease some of the strain. But as our chief investigative correspondent Carolyn Jarvis reports in this Global News exclusive, Ontario and the federal government have known about the labor shortage for years.
At the Michener Institute, labs that have been mostly dark during the pandemic will soon be buzzing with students. A fast-track program, 2 days online followed by 2 hours in this lab, will start cranking out new workers to address a labor shortage.
We're looking to those who already have a science background in microbiology. So these are learners who already have a university degree, either at the baccalaureate or master's level.
The program is funded by the Government of Ontario. Students who complete it will serve a supporting role in labs.
We built the platform to be able to scale up by the end of November, upwards of about 600 learners.
But these new auxiliary workers won't be able to analyze results. That's the role of a technologist.
We need qualified, licensed medical lab technologists who actually perform the test. And all the labs are vying for the same pool of individuals.
By some estimates, Ontario is short 200 to 300 lab technologists, certified workers who complete a 2 to 4 year program. Dr. Tony Mazzuli's lab at Toronto's Mount Sinai Hospital needs 15 more of them now.
We're running 24/7, so it isn't just one shift. We need people to cover 3 different shifts, 7 days a week, and that's where it's getting tight.
People are coming out of retirement while existing employees are putting in overtime and foregoing vacation. For some, the notion of a day off is laughable.
I think it was end of March or the beginning of April. There's some days where it's only been 8 hours, so I'm kind of happy about that, but on average it's way more than that. Yeah, 14 hours a day.
The frustration for many is that it didn't have to come to this.
70% of labs in Ontario were understaffed prior to the pandemic.
Industry associations have been asking governments for years to increase the capacity of lab training programs and warning of a retirement drain.
In Ontario, 50% can retire in the next 5 years, and many can retire now.
The strain falls to the front line with an unrelenting demand at the door. Carolyn Jarvis, Global News, Toronto.
With the U.S. presidential election just weeks away, both candidates are honing in on the battleground state of North Carolina. If Donald Trump's frequent visits are a sign, the state is critical to his effort to get reelected. It's big for Democratic nominee Joe Biden, too. They're fighting for every single vote because it's just too close to call. Jackson Proskow is in North Carolina tonight with more. Jackson?
In fact, Robin, this may be the most important swing state in the entire country. So important that tomorrow both President Donald Trump and Joe Biden's VP pick Kamala Harris will be here at the same time with competing events. And as you alluded to, President Trump has been here 8 times since July. That is an incredible amount of presence in this one state. Part of the reason why it's so important is because things can easily go either way. Barack Obama won this state in 2008, lost it in 2012. This time around, the stakes are so much higher, and it's not a simple cakewalk for President Trump. Yes, he won it in 2016, but this time around, the polls suggest he's in a very close fight, perhaps even behind Joe Biden. And the Republican incumbent senator in this state is also in a real fight for his job. What really makes this state so important, though, are its electoral college votes. Joe Biden would certainly like to have them. Donald Trump absolutely needs them.
Crucial for Trump. It would be nice for Biden if he had it, but if he carries North Carolina, I don't think there is much doubt about how the electoral vote will come out.
Jackson, North Carolina is being hit hard by the pandemic. The state is dealing with roughly 2,000 cases a day, the worst it has ever been. How is that weighing on voters?
You know, like everything to do with politics in this country, the pandemic is split along ideological lines as well. Republican voters we've been speaking to say that nobody could have done a better job managing this pandemic than President Trump. Democrats, on the other hand, say that literally anyone could have done a better job than President Trump has done. So that gives you a sense of the split there. That is not stopping President Trump, though, from coming to the state to hold a large rally here tomorrow. Thousands are expected to gather. It's an outdoor venue. There will be temperature checks in place, we should point out, and masks handed out. But as we've seen at these events previously, the masks are often ignored, and there is certainly no social distancing. One last note for you, Robin. The president's own approval ratings, both here in this state and across the country, have all gone down in the wake of his own COVID-19 positive diagnosis.
Jackson Proskow in Greenville, North Carolina. Thanks, Jackson. This is what it looked like last night in Liverpool, England, just hours before new COVID-19 restrictions kicked in. Dozens of people partied in the streets after the bars shut down. They'll stay closed for 4 weeks because the city is now under the highest alert on the UK system of COVID-19 restrictions. Liverpool has had a rapid rise in infections. It has the 3rd highest number of COVID-19 hospital admissions in Europe. France is also bringing in new measures aimed at curbing the spread of the virus. Starting Saturday, a curfew will be in place in Paris and several other cities for at least 4 weeks. Anyone caught breaking the nightly curfew will be fined. France recorded more than 22,000 new cases today. It's also seeing a rapid rise of COVID-19 patients in hospital. A Dutch woman is believed to be the first person to die after getting COVID-19 twice. Her case was recently published in the Oxford University Press. The 89-year-old had a rare form of bone cancer that compromised her immune system. Earlier this year, she was admitted to hospital where she tested positive for the virus, but her symptoms subsided completely. Nearly 2 months later, and 2 days after starting a new chemotherapy treatment, the woman developed symptoms again and tested positive for the virus. She died 2 weeks later. Scientists say the genetic makeup of the virus was different each time, making it likely she was reinfected. Speeding through space. Coming up, the historic flight for Russia's rocket, plus the big blast involving a relic from the Second World War. It's the end of an era. For the last time, NASA paid Russia's space agency to fly an American astronaut on board a Soyuz rocket to the International Space Station. And that rocket set a speedy record, arriving at the space station just 3 hours and 3 minutes after liftoff. In 2011, the U.S. Space Agency retired its shuttle program, so it was entirely dependent on purchasing rides from Russia. In a few weeks, NASA will turn to SpaceX, founded by Elon Musk, to launch crews to the ISS on the Dragon spacecraft.
But look at this! Look at them take this! Look at this!
Still ahead, the fury over lobster fishing in Nova Scotia. The largest unexploded bomb from the Second World War has detonated safely during delicate efforts to defuse it in Poland. Navy specialists were trying to neutralize the 5-ton tall boy remotely when it went off. The bomb was discovered last year in a waterway with only its nose exposed. It was dropped by Britain's Royal Air Force in an attack on a German cruiser in 1945. It missed the target and sank. Tensions are flaring around Nova Scotia's lobster fishery. At issue is the rights of Indigenous lobster harvesters to fish outside the commercial season, rights that are protected by a Supreme Court of Canada ruling. As Ross Lord reports, the violence is unfolding despite weeks of negotiations aimed at finding common ground.
Threats and violence are intensifying in the Nova Scotia lobster fishery.
The cops can't even control these guys, and there's a lot of them.
An estimated 200 commercial fishers preventing employees of a lobster holding pound from leaving and removing crates of lobster caught by Indigenous harvesters.
Put them down!
Don't touch.
What are you doing?
Don't touch. This is our fish.
Yeah.
This is our catch.
Indigenous fisher Jason Marr says he barricaded himself inside the pound, fearing for his life.
And then the RCMP came and told us that the only way that this was going to come to any kind of end was if I hand over my lobsters to them and I leave. When they said that, I said, no, I'm not doing that.
1 month after the Sibaganaggity First Nation issued licenses to fishers for a self-regulated fishery, their commercial counterparts insist no one should fish outside of the normal season.
You guys fish when we fish. That's all we want.
Protesters blocked access to a news conference planned by the Sibaganaggity chief, some threatening a global news crew with violence, forcing them to leave. A group that represents many of the commercial fishers says it had nothing to do with the violent protests.
That's not the path forward here. As Canadians, we should all expect that the path forward is through dialogue.
Assembly of First Nations National Chief Perry Bellegarde says he's appalled, a sentiment echoed by Fisheries Minister Bernadette Jordan. In a statement, Jordan says progress cannot be made if individuals resort to violence. But the chief of Sibaganaggity suggests the lack of trust extends to the government.
The government does not take us or respect us on a nation-to-nation level, which they should. And, when they do so, that will be victory for us.
In the meantime, RCMP say they're investigating threats, mischief, and property damage. They've brought in extra members to ease tensions before worse damage is done. Ross Lord, Global News.
Up next, from reality TV to documentary, Donald Trump stars in a new film focused on pandemic failures. A new documentary details how the Trump administration responded to COVID-19. It highlights the misjudgment, the missed opportunities, and how the White House is scrambling behind the scenes. Here's Mike Drolet.
Hello, everyone. There was consensus in the pandemic chaos in early March.
Over the past few days, we've seen COVID-19 spread around the world.
World leaders mostly followed the same script. locking down major cities on the advice of doctors and scientists as the infected were quarantined in hospitals. It's in that context the documentary Totally Under Control examines a U.S. response that was anything but.
Whatever happens, we're totally prepared.
You know, I think in the early days, it felt like we're like, oh, this is this unprecedented virus. We've never seen anything like it before. We don't know how it's going to respond. It's just not true. There were experts who did know exactly how it was, going to unfold, and they predicted it. And their warnings were ignored.
For months, the documentary's 3 directors kept their work a secret so as not to scare off potential whistleblowers.
It is time to lay our careers on the line and push back.
They focused on those crucial early months when an already culturally fractured United States was desperate for leadership, but instead got platitudes in politics.
It'll be wonderful. It'll be a gift from heaven.
It's complete bullshit. He has no idea what he's talking about.
And that's kind of the tragedy of the story, is that all of their skill, all of their dedication to public health was undermined and upended by an administration that simply wanted to put politics above everything.
The film's release less than 3 weeks before the U.S. election is no coincidence. It's meant to be a report card for the Trump administration, and while it will no doubt be championed by the left and derided as fake news by the right, there's no denying not enough is being done in the U.S. to slow the spread of COVID-19.
But the big problem now is that there's no plan. There's no coordinated federal plan in order to deal with it properly. There's just the purposeful absence of a plan.
How many Americans agree with that? We'll find out on November 3rd. Mike Drolet, Global News, Toronto.
And that is Global National for this Wednesday. I'm Robin Gill. Tonight we leave you with Mars reaching opposition to the sun and the closest point to Earth. That puts the red planet, just 62 million kilometers away. It's not due to be this close to our planet for another 15 years. Thank you for watching. Donna Friesen will be back here tomorrow. Have a great night.